America is home to 33 million small businesses, the beating heart of communities across the country.
And proof that the American dream is still alive.
This is a show about those dreamers and doers and the communities they serve.
Their real life stories.
Their struggles and successes.
Their grit, determination, and passion.
And the people who fight
to keep their American dream alive.
I'm Alfredo Ortiz.
I'm Elaine Parker.
And it's time for another episode of Main Street Matters,
America's small business megaphone.
Hi, everybody, and welcome to another episode of Main Street Matters, America's small business megaphone. I'm Elaine Parker, the president of the Job Creators Network Foundation, and today we're joined by Brandon Arnold. Brandon's the executive vice president of the National Taxpayers Union. He helps oversee strategic planning and government affairs efforts. Brandon, welcome to Main Street Matters.
Thanks so much for having me.
Well, as I was saying before we started, I'm so excited to have you on because I would like to talk about the shutdown. I know everyone's talking about it. I know that there's a lot of finger pointing going on, but I just really want to talk facts because I get so tired of the talking points. And I just so let's just start from the basics. What exactly is included in this clean continuing resolution? What's in it and what's not out of it? What's not in it?
Yeah, it's a pretty straightforward continuing resolution. You know, a lot of times they tried all these shenanigans. They try to jam in controversial policies and riders and extra spending, what have you. But in this case, it's a pretty clean continuing resolution. All it does is keep the doors of the government open for about 7 weeks, taking us to close to the Thanksgiving holiday, just before Thanksgiving. So the fact that Democrats are getting as upset as they are about this and trying to shutting down the government as of yesterday over a pretty clean continuing resolution is surprising, particularly when you look at what's happened in the past, where so often Democrats have been decrying Republican efforts to achieve policies using a government shutdown as leverage. The shoe is on the other foot right now. And it's almost comical to watch if it weren't so bad for the economy and for many businesses as well.
Yeah, and I'm just curious, from what I've read, the CR that's clean and just says, hey, let's just continue writing the checks as we've been at the same level. Isn't that still at the Biden era level of spending? Like, we're not cutting any spending in it. It's just continuing on, right?
Yeah, it's level spending because Congress has not done its constitutional responsibilities of passing these appropriations bills. Each year, they're supposed to pass 12 appropriations bills. It hasn't. We've been living under a continuing resolution, which means, yes, we're continuing the funding levels that were passed under the Biden administration. That makes it all the more surprising that we're seeing this type of fight. Of course, from a limited government perspective, if we can hold government spending level from year to year, then that's often a victory, because the normal practice in Washington, of course, is to elevate spending, to keep spending more and more and more each and every year.
Right. And of course, then there's the game of when they do say they've actually just cut the increase, the level of the percentage of increase that they're going to make. They're just not going to increase it as much as they were. So they call that a cut in Washington, D.C. too. So there's always the D.C. speak, if you will. But so the stopping point here is the Obamacare credits. From what I understand, the Obamacare credits are not going to go away. People who get subsidies with Obamacare are still going to get Obamacare credits, but what they're taking away is the additional credits that were passed under the Biden administration during COVID as the emergency credits. And so that enhancement is what they're looking to cut back to. So basically going back to pre-COVID Obamacare credits. Am I right?
Yeah, that's absolutely right. You know, it's really interesting to watch Democrats talk about this policy as if we're taking away people's health insurance, as if people are going to be dying in the streets if these expire as they're scheduled to do at the end of the year. When the fact of the matter is, these credits were created exclusively by Democrats under the Obama administration in 2009. So they were good enough for Democrats back in 2009, and all of a sudden the sky is falling here. They enhanced them, as you said, Elaine, in 2021 during the COVID crisis, and again re upped that extension in 2022, the very next year. All good enough for Democrats then to see them expire once the threat of COVID was in the rearview mirror. But now, even though the pandemic is over, all of a sudden it is irresponsible in their eyes to revert back to those 2009 levels of subsidies to make sure people can afford their health insurance.
So why do we keep hearing that this is about taking healthcare away? The Democrats are saying people are going to actually get kicked off their healthcare. How is that possible when the credits are still going to be flowing? There's going to be flowing at pre-COVID levels.
Yeah, I mean, the people that I'm worried about losing their health insurance are people that can probably afford to pay for the insurance on their own, because some of these credits are going to people making $500,000 a year, people who should not be receiving support from the federal government, people who can afford their own health insurance. And the other thing that we've seen, and the Wall Street Journal laid this out very, very nicely in an editorial a few days ago, is that people have left the employer sponsored market where they're getting insurance to their employer and moved into the Obamacare exchanges because those subsidies were so generous there. We would like to see the government shrink back, reduce its role, because it distorts healthcare policies. It drives up costs more often than it reduces costs. Allow those federal supports to exist only for people that are truly needy, that really need the federal government to help them. Otherwise, they wouldn't have insurance, and otherwise allow markets to function properly. That helps drive down rates. That helps reduce the burden on other taxpayers here who shouldn't be on the hook again for people making $500,000 a year.
Okay, so I wasn't aware that people who make a $500,000 a year are eligible for these tax credits. That's very much news to me, and I assume most ordinary Americans who are paying premiums out of their paycheck on their employer-sponsored insurance coverage. How is that even possible that somebody making a $500,000 a year could get Obamacare credits? I thought that was for low-income people.
That was the 2009 law, but then during the COVID crisis, the pandemic, that's what they did. They decided, hey, everybody's going to be in a tough spot here, even people that are relatively well off. Therefore, we're going to restrict these limitations that we put in place, these means testing provisions, to try to make sure that it was only benefiting working class Americans. And yeah, that might have made sense during the pandemic when everything was chaotic, when the government was shutting down businesses, and we kind of stopped functioning normally as a society. But it doesn't make sense here today in 2025 and going forward when we're past the pandemic. We need to put those means testing provisions back into place. We need to make sure that government support is only going to the truly needy, not to the well off, and not, by the way, being used to pad the profits of insurance companies. That's just effectively what they're doing here with the enhanced premium tax credits.
So, can I take a step back with you and just look at the um, the the issue that we need these credits at all is because Obamacare is not never accomplished what Barack Obama originally said it would, and that was to decrease the cost of healthcare, and that's why these people get healthcare credits to help them pay for very expensive healthcare.
Yeah, I mean, once you introduce something like these premium tax credits, you're effectively creating a permanent benefit that's always going to persist, because insurance companies, and I have nothing against insurance companies, but they are going to be able to take that additional premium and then add to it whatever people are able to afford to pay. So you end up driving up costs. If they had to actually reach down to where people are, what they can afford to pay, then maybe you would achieve more broad across the board reductions in medical expenses. But we've seen medical costs far outpace inflation, even when inflation has been absolutely insane through the roof during the Biden years. We've seen inflation in the medical space increase so dramatically. People, we hear so much from senior citizens who can't afford their prescription drugs. We hear people who can't afford insurance, or even if they have insurance, don't feel like they have sufficient coverage to go to the doctor and get the care they need. That all has persisted, even though, as you said, Obamacare was supposed to solve all these problems by insuring everybody. That has not been the case. We still have a lot of work to do in our healthcare sector.
Yeah, it's a shame. I was talking with somebody, and there's a lot of interesting healthcare ideas out there that we could do pilot programs in different states and try them to see what works, what would work to get us more towards a free market healthcare system where we get these middlemen out of the system and kind of remove the complexity of it. And if we could just try some of these programs in different states, we could see what works, maybe on a national basis or even, state by state would be fine too. But the forces against moving towards anything that actually solves the healthcare crisis and the inflationary pressures in the healthcare. Those forces are just so great from the healthcare industry, the health insurance industry to the PBMs. I mean, the inertia that they want to keep so that they have the status quo is so strong.
Yeah, I think we have made some gains. I mean, in 2003, we brought health savings accounts or HSAs into
Mm,
the equation. I think those are underutilized. I think we need to find mechanisms to make HSAs work better. And a lot of healthcare experts have explored that. For instance, allowing people to purchase their health insurance using HSA dollars,
yeah.
I think would go a long way to do that. But we haven't achieved that broad-based integration of HSAs into the healthcare space that we really need. And the brilliant thing about HSAs, of course, is that they put people rather than insurance companies or rather than hospitals or you name it, they put people in control of their own healthcare dollars. And when people have control of their own dollars, they start asking things like, "Well, how much is this procedure going to cost?" Or "This
Right.
drug sounds good, but this one is also is a little more affordable. Wouldn't this work for me as well?" And we start asking those questions. That is called the free market that is driving down healthcare costs and increasing transparency. That's a beautiful thing and it's far more effective than any government program.
And that is so simple when you talk about it because right now we don't have a true, I guess you would call it a consumer system right now in healthcare because we as patients, we don't have an incentive to ask those questions because we only care about two things. What's my monthly premium and when do I meet my deductible? That's it. That's all we care. We don't care about what the service costs. We only care about how little we have to pay to those two buckets, right? And if we could put patients in charge of the entire process in terms of the service and allow them to shop for those kinds of services, the cost of these services would come down. It is absolutely proven that when you inject free market and competition and price transparency, prices come down. We see it across the board in industries like plastic surgery. I mean, think about the cost of plastic surgery now it's come down. Think about orthodontia. You can shop for orthodontia for your children, and if you're not, you should be because there's varying prices out there. Because I found a ton of different pricing out there and services available, and I shopped. What's it called? The LASIK surgery. When it first came out, it was very expensive. The price is cut in half now because the technology is good and they have to compete for dollars. And I'm not saying we create a system where you're walking in and saying, I have a heart attack. How much are you going to charge? Those are emergency type services. But when you're dealing with primary care type services, elective surgeries, things like that, you should be able to understand what the cost of these services are. And if you do, and you have a stake in it, then you care. And right now, we don't have consumers that care what the cost is.
Yeah, you said it absolutely beautifully there. And, as somebody who's in the process of buying orthodontics for my child, we took the kids to two or three different orthodontists, and we tried to figure out which one we like the best, which one offers the lowest costs, high quality at the lowest cost. But people simply don't do that. If you're in the hospital and the doctor's like, "Hey, maybe we'll do an MRI here. Insurance company's going to pay for it." what the heck, let's run an MRI. There's just not that same mindfulness of the cost to benefit ratio of undergoing all these diagnostics, of applying additional care that may or may not be necessary, may not be warranted by the additional costs there. So we really need to rethink the way that we're administering healthcare. And I don't think this fight over the premium tax credits, these enhanced premium tax credits, of course, is going to do anything about it. Is going to cost taxpayers roughly $40 billion dollars a year in higher costs at a time when we have a $37 trillion national debt and climbing. So the healthcare piece is a huge driver of that. When you look at Medicare and Medicaid costs, enormous driver for overall health, overall red ink picture that we have right now as a country here. And we need to be thoughtful. We need to be a lot more innovative than simply holding our breath, kicking and screaming, and shutting down the government over giving taxpayer-funded subsidies to people making $500,000 a year.
So I hear a lot of words right now, like from people like Bernie Sanders and Chuck Schumer, who are saying that Speaker Johnson is lying, that illegal immigrants are not getting health care, and that it's illegal for that to happen. And Speaker Johnson is saying, and the Republicans are saying, it is happening, it has happened, and the big beautiful bill went to was able to remove a lot of those people and keep Medicaid there for the people who specifically need it. The poor, single moms, people like that. What is what is the explanation behind the shenanigans in terms of illegal immigrants that do get health care through with taxpayer dollars?
Yeah, it's interesting because the Congressional Budget Office plays such a huge role in the passage of big bills like the One Big Beautiful Bill Act. And all of the provisions in order to go through the reconciliation process, so you only need 51 votes in the Senate. All of the provisions are basically run through the Congressional Budget Office to show that they have a budgetary impact. And the provisions that the Republicans put in the OB3 package to remove illegal aliens, people who are in this country illegally and should not be receiving benefits, were demonstrated to have a score that saved billions of dollars. So if they're not receiving care, if people in this country are not illegally are not receiving care through the Medicaid program, then that score would have been zero for the provision to remove them from the rules. So obviously, CBO knows a lot more about this than Bernie Sanders and Chuck Schumer and people who are a lot more politically minded here. And there should be agreement on that. When you think about it, there's so much political rhetoric, so much partisanship right now in Washington, but that should be pretty straightforward. If you are in this country illegally, you should not be receiving taxpayer benefits. It's really that simple. That's one of those 80-20, maybe even 90-10 issues that for Democrats to make this the hill they're dying on is pretty ridiculous. There are a lot of reasonable areas that we can disagree upon as a matter of public policy, but that to me seems pretty straightforward. It saves a lot of money. And if you undo, as they would in this package, they've the counter offer on the continuing resolution. If you rip out all the One Big Beautiful Bill changes to Medicaid, guess what? You rip out that provision that is proven by the Congressional Budget Office to save money and would indeed remove illegal aliens from the Medicaid rolls.
I knew there were shenanigans with it. I hadn't heard your perspective on the CBO score. I've heard all of the, how California gives illegals health care through their state funded health insurance, but then they get reimbursed by Medicaid, and that's how they get around it, which would technically make what Chuck Schumer is saying correct. Technically, they're not getting Medicaid directly, but they're getting the federal dollars. The CBO score is an interesting perspective, though. You're right. If it wasn't happening, there'd be no score because it wouldn't be costing anything. So that's an interesting perspective. So from your vantage point, where are we on negotiations? Are we even having any negotiations?
Yeah, well, not today. Maybe not for a couple of days. I think they're going to try again in the Senate, perhaps as early as tomorrow, to get a continuing resolution passed. I don't think there's been enough in the way of movement between either party to make that happen. So it's going to flip till next week at the earliest, unless there's some sort of late breaking development. But I don't anticipate that anything could potentially move until next week. And I think the fact of the matter is Democrats have a lot more skin in the game than Republicans. If you talk to the Republican base right now, they're like, shut down the government. We don't care. Uh, I think they're maybe a little bit flip about that, but I think the Republican base is a lot more shut down the government. It's less important to us than it is to the Democratic base. And so I think there are going to be some additional members of the United States Senate, Democratic members, that start to join Republicans on the clean CR. And they're certainly going to be asking for stuff along the way. But we saw the initial vote in the Senate only got one Democrat. Now I believe they've got three Democrats. I think that number is going to increase until they do get the requisite 60, even if Schumer is not part of that block. I think there are enough rank and file Democrats that are going to go along with Republicans ultimately to open up the government over in the next week or two. Just my prediction. Then the big question is what happens right before Thanksgiving when we're facing another shutdown? We're back in the exact same scenario. Are the dynamics going to be different in that scenario or not? I don't know. That's going to be a lot trickier.
Yeah, for sure, because they will not have all the appropriations bills done as much as Speaker Johnson wanted to get us back to regular order and do those. How long? So there's sort of like a fake date out there, right? Like yesterday was sort of a fake date, is what I've heard, because the next payday for government employees is, I think, October 9th or 10th. So technically, don't they have until that time to actually get a deal, to be able so that nobody misses a paycheck?
Yeah, I think that's another inflection point here, but I don't think that's a mover for Republicans to move toward the Democrats' position. Maybe that moves the Democrats to the Republicans' position a little bit. And also keep in mind, this isn't great if you're a federal employee necessarily, but back in 2019, Congress passed a law that says that all furloughed employees receive full back pay in the event of a shutdown. So even if they're not going to get money when they're supposed to, they will eventually get all the pay that they're entitled to. Whether that's a good thing or a bad thing probably depends on your particular views on the federal workforce here. And certainly from the perspective of a federal employee, it may create cash flow problems. Just because you get the money when the shutdown ends doesn't mean you're able to pay the rent or the cell phone bill or what have you when it pops up in your inbox. So it can create problems there. I don't anticipate that this shutdown is going to be tremendously long, like we saw in the first Trump administration. But we'll see. It is encouraging to see Democrats one by one start to move closer to the Republican position here and to pass this clean, very short term 7 week continuing resolution to open up the government.
So do you feel like the Republicans are doing enough to get their side out there, or you just feel like, or are the Democrats just in on such, you know, poor standing right now in terms of their popularity, and the issue that they've taken up, that it's just so bad? And are the Republicans doing enough to explain their position, or what could they do more?
Yeah, I think Republicans kind of have the upper hand if you explain this issue to the average person out there. Like, listen, they're just trying to keep the government open. Democrats are asking for $1.5 trillion in higher spending and these subsidies and so forth. I think Republicans win that argument. At the same time, because Republicans are perceived correctly to be in charge of Washington, when something bad happens in Washington, most voters are going to say, well, Trump's president, Republicans control Congress, it's their fault. But any way you cut it, I think this drives down overall support for Congress and the president. To be fair here, I think everyone just sees why can't these children act like adults for once? Why can't they actually have mature conversations, keep the government open, and do what we send them to Washington to do? So I think everybody ends up looking bad. But Republicans' messaging here again is pretty clean cut. I think it's pretty straightforward, and I think they do have for once in these shutdown. I think debates almost always tilt in the favor of Democrats, but for once, I think Republicans have a bit of the upper hand here when it comes to the message.
I do too, and I'm a big fan of Speaker Johnson. I think he does a really good job, himself. Not everybody does, but he does a really good job at explaining what's happening, and he doesn't really even address the subsidy issue. He just talks about in terms of we have to keep the government open. That's a conversation we can have, but we have to keep, on the healthcare stuff, we don't want anyone to lose their healthcare. We can have that conversation, but we just need to keep the government open right now. And he just does a really good job at matter of factly putting that out there. And it makes sense.
Yeah. I share your affinity for the speaker. I think he's done a great job in messaging. I think he's done a great job in keeping a pretty fragmented conference, a lot of different viewpoints within the Republican Party right now. But I think he's done a pretty good job of holding Republicans firm in a unified position here that, hey, this is pretty straightforward here. This is about as straightforward as it gets in Washington. 7 weeks, keep the doors of the government open, no radical changes to policy, no major secret provisions in this bill. It's about as clean a CR as you're going to get. And that really puts the onus on Democrats here. The more they filibuster, which is what they're doing in the Senate, the more they filibuster this bill, the more this shutdown is on their shoulders, not on the Republicans in Congress. And that's not a good look for them, especially as time goes on, as we get closer to the Thanksgiving travel period, and maybe the TSA agents stop showing up for work because they're not getting paid. Maybe there are more disruptions to flights. Maybe there are more disruptions to the administrative component of Medicare and Social Security programs that seniors rely on. Guess what? If Democrats are holding the bag there, it's going to look really, really bad for them.
Yeah, for sure. Well, switching gears, the NTU and JCN are part of the same coalition. Um, and we work on a piece of legislation together called the American Franchise Act. Um, Tell us a little bit about the history of that and what the American Franchise Act is going to do.
Yeah, absolutely. And thanks for your support. We have about almost 20 free market organizations, taxpayer groups, limited government proponents signed onto this coalition letter in support of a bill from Kevin O'Hearn, a great Republican member from the state of Oklahoma, a former franchise owner. And he looked at this issue. It's called the joint employer issue, in which basically, you see the federal government trying to perceive small businesses that are organized under a franchise relationship as being part of the larger entity. So essentially, if you own a single McDonald's in a franchise relationship, you are a small business owner. You own a single restaurant here, but they want to regulate you and expose you to legal liability as if your employees all work for the large corporation, McDonald's itself. And that's really unfair because that puts additional regulatory costs. It could expose, as I said, liability. If an employee sues not just a small business, but also all the way up the food chain and sues the corporate entity as well. This issue has gone back and forth in the regulatory process for many, many years. And you saw the Obama administration pass a joint employer standard that exposes these small businesses to additional regulation. That was struck down by the Trump administration. Biden came back and tried to reinstitute the Obama regulations. That was struck down by a court. And what this bill does is pretty straightforward. It just says we're not playing this game anymore. We're not going to let the pendulum swing back and forth and endanger these businesses along the way. We're going to make it a statute whereby these are small businesses and the employees that work for them are working for small businesses, not for a major corporation. It's pretty straightforward, does have bipartisan support, and it should be a no-brainer. It should be something that Republicans and Democrats can pass together jointly in a bipartisan fashion and get to Trump's desk.
Well, it's such an important issue for our small business owners who franchisees represent a lot of those small businesses. I think people sometimes forget when they see that very recognizable logo on the outside of a store, whether it's a McDonald's or a Sir Speedy Printing. Those are independent small business owners who have bought into the franchise system, but they own everything. They own the materials inside. They employ the people. They make the payroll. They pay the taxes, and they make the profits. They've just bought into a system that works, and it's a great system. And it is, creates a lot of jobs and a lot of tax revenue, frankly. But it is threatened by the joint employer. And so I'm glad to see that Congressman Hearn brought forth this legislation to codify it because we were just talking before we came on. I think we've been dealing with this issue for more than 10 years at this point, back and forth, back and forth, back and forth. So it'd be nice to just put this one to bed, right?
Yeah, amen. And for us, it's a policy issue, and it's annoying to see it pop up, and we're glad to roll up our sleeves and work on it. But for the franchise owners, it could be a life or death situation when they're subject to collective bargaining, when they're subject to additional regulations, these liability exposures that they're facing. This is like an enormous issue for them. So hopefully Congress can see the wisdom in what Kevin Hearn has introduced here. Hopefully we can get this to the president's desk and take that concern completely off the table for these franchise owners. They're the small businesses that hire people, as you said, they create jobs and that are the backbone of America's economy.
Absolutely. Fingers crossed. Fingers crossed. Well, tell everyone where they can learn more about the National Taxpayers Union and what you and your team are working on.
Yeah, absolutely. Thank you so much, Elaine. And you can find out more about National Taxpayers Union on our website, ntu.org. We're, of course, all over all the social medias, Twitter, YouTube, you name it. We're out there. So please check us out. Let us know what you think. We are the voice of America's taxpayers at all levels of government. So we're in state capitals, we're in Washington, working on behalf of the American taxpayer, try to lower the taxes, reduce the size and scope of the government, and make sure that people can live the American dream to their best ability.
Absolutely. Well, Brandon, thanks so much for taking the time to join us on Main Street Matters, America's small business megaphone. And thank you all for taking the time to tune in. Main Street Matters is part of the Salem Podcast Network. New episodes debut every Wednesday and Friday. You can subscribe to the show wherever you get your podcast from, and we'll be back soon with another episode. Bye for now.